Take a look at the numbers tonight. You see that we are doing some record-breaking numbers of people rolling up their sleeves to get the shot. More than 81,000 Marylanders got vaccinated yesterday, and more than 1.5 million have been fully vaccinated so far. Our vaccinations are going strong despite Johnson & Johnson's vaccine being put on hold. WMER2 News' Dave DETLING spoke with a healthcare expert on why this should not deter people from getting the vaccine when it becomes available again.
Well, talking to one Maryland healthcare expert, he's putting the number of reported blood clots in perspective. He also says it's only a matter of time before the J&J vaccine becomes available once again. With the administering of the Johnson & Johnson vaccine on hold, the FDA and CDC continues to review the handful of cases that recently caused alarm. They include 6 rare blood clot cases. They occurred 6 to 13 days after vaccination, and they were found in women 18 to 48 years old.
We need to understand more about this specific complication rare complication that can occur after the J&J vaccine.
Dr. ALOKE Finn, an interventional cardiologist and associate professor of medicine at the University of Maryland School of Medicine, says people who have received the vaccine should not panic.
We need to keep in perspective, as you mentioned, it's a very, very rare complication. And for the vast, overwhelming majority of people in the United States, getting the vaccine and preventing complications of severe COVID greatly outweigh the risks of this kind of problem.
Health officials say those who have received the Johnson & Johnson vaccine and develop a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination should contact their healthcare provider. Here in Maryland, there have been no reported cases. Earlier in the week, Governor Larry Hogan said vaccination rates would not be impacted by the halt.
I would imagine some private contractors, hospitals or pharmacies or doctors obviously might have to cancel a few people's appointments, but again, we can handle them at our mass vac sites, and we have Pfizer and Moderna.
As for when the J&J vaccine will be available, that's still unclear. But Dr. Finn says what's occurred should not dissuade people from being vaccinated.
My message is keep this in perspective. This is occurring at this point, as far as we know, in less than 1 in 1 million people receiving the Johnson & Johnson vaccine. So the chances it would happen to you are extremely unlikely.
And Maryland state health officials say that at the mass vaccination sites, doctors continue to use the Pfizer and Moderna vaccines. We're in Baltimore. Dave DETLING, WMAR 2 News.